All month long, we've been sharing simple tips for keeping your heart in good shape. And as we continue with Heart Health Month, we should also focus on the other side of the spectrum. What happens if you don't take care of it? Dr. Brent Lampert is a heart failure specialist at the Ohio State Ross Heart Hospital and is here with some great advice. So it's good to have you, Dr. Lampert.
Thanks for having me, Robin.
So we are all kind of focused on improving our heart health this time of year, but in order to improve it, we kind of have to know, first of all, what we're dealing with. So how do we know if we have a healthy heart in the first place?
Sure. I think the first thing is to understand what your heart does. So your heart's job is to pump oxygen and nutrient-rich blood to the rest of your organs and muscles and all the tissues in your body. When it's working well, it's really powerful. It can pump 5 to 6 liters of blood per minute. But if the heart pump starts to fail, patients can develop a condition called heart failure. They may notice they become more short of breath, more tired. They may have swelling in their ankles, their feet, or their abdomen. They may notice rapid weight gain. Other heart conditions, your heart needs its own blood supply, so it has arteries that supply it blood called coronary arteries. Those can get blocked in a condition called coronary artery disease, which can lead to angina or chest pain, type of pressure that people may get when they try to exert themselves. They may also feel nauseous, sick to their stomach, or have sweating. And then finally, your heart pump has its own electrical system built in that helps coordinate all of its activities. So if you develop any abnormalities with that, patients may notice palpitations or a sensation of their heart racing or flip-flopping in their chest. They may feel lightheaded or dizzy or even faint. Any of those type of symptoms should cause them to seek medical attention right away.
Yeah, those are all warning signs, whether they present themselves a little bit in advance or right before something's going to happen. You always need to be aware that those things are related to your heart. So are lots of people hesitant to kind of go to the doctor and just say, I want to find out if my heart's healthy?
Certainly, out of sight, out of mind, people want to ignore it. But, if I could say anything, is just to reassure people that for all of those conditions, we have great treatments that can strengthen the heart, make people live longer, make them feel better. So if you're having any of those symptoms, really seek medical attention.
What are some of the biggest steps that we can take, just watching this, to make sure that we're doing the best we can for our hearts?
Sure. The good news is most of the things that cause heart disease or lead to heart disease are modifiable. So, first and foremost, if you're a smoker, absolutely have to stop smoking. Stopping smoking can reduce your heart disease risk by half in just a year. So it's really important. And even if you're not a smoker, but you're exposed to secondhand smoke, trying to put yourself in a situation where you're not going to be exposed to that will be helpful. Exercise is really important, and you don't have to be a marathon runner or a biker or a weightlifter. It's little things. Low, even moderate intensity exercise like walking, doing yard work, even doing housework counts.
Right.
So, ideally doing 30 minutes of that most days of the week would be helpful. And then watching your diet, all the common sense stuff that we know about, the red wine you alluded to, and moderation, but more importantly, fresh fruits, vegetables, lean meats, whole grains, avoiding sugary, saturated fats. And then finally, if you have other health conditions, things like diabetes or high blood pressure, high cholesterol, things that put you at risk for heart disease, make sure you're talking to your doctor and treating those.
Yeah, monitor those issues.
Absolutely.
It's important. So you take care of many hearts. Your specialty, though, for those who are suffering from heart failure, sometimes referred to as congestive heart failure. What exactly is that?
Well, there are two types of heart failure. One is the one that I alluded to earlier, when your heart pump gets weak and it's not able to effectively deliver blood like it should to the rest of your body. The other type of heart failure is actually your heart still is strong, it pumps okay, but your heart muscle gets thick and stiff and can cause the same type of symptoms because it can't effectively fill up with blood. So those are the things like the shortness of breath, the fatigue, the swelling, the weight gain that can come from heart failure.
Now, you have a special program and really an entire floor at Ross Heart Hospital that's dedicated to treating heart failure. So that in itself makes, the hospital special. But aside from that, just kind of quickly tell us, what makes these approaches that you have to treat heart failure so unique?
Sure. We're fortunate to have, first and foremost, a great team, a multidisciplinary team. We have nurses, pharmacists, social workers, dietitians, surgeons, and 11 heart failure cardiologists with specialized training in cardiology and advanced heart failure that really try to come up with an individualized treatment for each patient. Being an academic center, we have access to over a dozen clinical trials at any given time for heart failure to give people access to medications and treatments that aren't yet available to the general public. And then for a small percentage of people, despite the best treatment, their heart failure will progress to what we call advanced heart failure, where their symptomatic even just sitting at rest and coming in out of the hospital. And for those patients, we offer heart transplantation. We're the only heart transplant program in Central Ohio. I've done over 400 transplants since the program started, and 25 last year alone. And then finally, for patients who may not be a candidate for a transplant or are too sick to wait, we offer mechanical circulatory support, or what are called ventricular assist devices. These are small pumps that are implanted by our surgeons to help the heart more effectively deliver blood and either bridge people to a transplant or just get back their quality of life. And we typically do about 50 of those ventricular assist devices every year.
A lot of success, a lot of
Absolutely.
innovation. I want to remind people, if they want to get lots more about ways that Ohio State is treating heart failure and ways to fight and be healthy, go to wexnermedical.osu.edu/heart. I want to thank you, Dr. Lampert, for being with us.
Thank you.